Welcome to this event that's being co-hosted by the Humanitarian Policy Group and GSMA's Mobile for Humanitarian Innovation. It's great to see so many of you joining the call. Please do introduce yourselves in the chat box. I'm Barnaby Willitts-King, Senior Research Fellow with HPG, and I'm delighted to be joined today by a fantastic panel who bring perspectives from around the world on today's topic of COVID-19 and digital humanitarianism. And I'll introduce them in just a moment. We're really delighted to be partnering with GSMA on this, and we'll be hearing shortly about GSMA's new report just out on this topic. Here at HPG, we've been researching the interface of digital technology and humanitarian action for almost 2 years and put out a research paper last year looking at COVID-19 and the digital divide. So today we're going to be looking at a number of really interesting questions like what impact has COVID had on the use of digital technology in humanitarian crises? How has technology helped bridge digital divides? And what have we learned about building a stronger system to respond to hazards in the future using technology? Also, how are partnerships evolving between governments, the private sector, and civil society? A few headlines from our research really some predictions at the beginning that COVID-19 would radically change how digital technology is used in humanitarian action, but these haven't yet materialized. The most effective tools have been those already known to work at scale, such as providing digital cash through mobile money. By contrast, some proposed new uses of technologies, such as drones to check for fever, haven't been that effective, and others, such as contact tracing apps, might expose aid users to greater risks to their privacy or inappropriate surveillance. Marginalized groups are already at risk of being excluded by digital approaches when such tools are being used. And this is exacerbated when the tools are being used remotely, as has been necessary during the pandemic. And systems that you rush to put in place during a crisis will outlast the pandemic. So it means that you need to have really careful assessment and mitigation measures, even in the middle of an emergency. And finally, humanitarians are not using digital technology in a vacuum. They need to work more closely with a wider range of actors, governments, the private sector, and understand both the opportunities and risks that this presents. The increased and rapid uptake of digital tools clearly increases the potential for digital harm, but we haven't found as many examples as you might hope of organizations sharing how they're mitigating this. So that's an area we'd like to hear from you in the audience. I know that many of you joining today's call bring expertise and experiences of technology use in humanitarian responses. And so we'd love to hear your perspectives too. You can share your thoughts and reflections in the chat. And if you have a question for our panel, please do use the Q&A box to send these in and I'll put them to the panel a little later on. If you're on Twitter, we'll post the hashtag and Twitter handles in the chat now. Finally, closed captions are available during this event by clicking on the button at the bottom of your screen. And this event is being recorded. The video will be available on the event webpage in a couple of days' time, and you can listen back on the discussion through the ODI event podcast channel. Now, let's meet the panel. So firstly, I'm delighted to welcome Mahamud Abdirahman, Director of Business Development and International Relations Division at Telesom Company. Telesom is a telecoms company that was established in 2002 in Hargeisa, Somaliland, and is one of the leading providers of ICT in the country. And Mahamud has worked for the company for the past 12 years and has led projects that work in partnership with humanitarian organizations. A very warm welcome also to Adelina Kamal. Adelina is the Executive Director of the AHA Center, the ASEAN Coordinating Center for Humanitarian Assistance on Disaster Management in Jakarta. And Adelina has led the AHA Center in facilitating ASEAN's collective response to major disasters, including back-to-back multiple emergencies in 2018, where the AHA Center played a major coordinating role. And prior to working with the AHA Center, Adelina served for more than 20 years in the ASEAN Secretariat. And I'm very pleased also to be joined by Justin Colvard, Mercy Corps' Country Director for Haiti. Justin is an international development and public health professional with over 10 years experience across sub-Saharan Africa, South and Southeast Asia, and the Caribbean. Justin has worked in various sectors, including disaster preparedness and response, digital financial inclusion, food, nutrition, water security, and social and behavior change. So a great panel. And we're also joined by Zoe Hamilton, who is Insights Manager for GSMA's Mobile for Humanitarian Innovation. Zoe has designed and delivered a range of research projects across M4H's thematic areas, specializing in the inclusion of marginalized communities and the issue of the digital divide. So Zoe is the author of M4H's report just released on COVID-19 and digital humanitarian action, trends, risks, and the path forward. And to kick us off, I would like to hand over to Zoe now to give us an overview of the key findings from the report. Thanks, Zoe.
Great, thanks so much, Barnaby, and hello, everyone. It's great to be here. As Barnaby mentioned, I am an Insights Manager on GSMA's Mobile for Humanitarian Innovation team. Last year, when COVID-19 began to spread around the world, GSMA's Mobile for Humanitarian program faced an influx of requests from stakeholders, including from within our own portfolio, about how to ramp up digitization of services to respond to the pandemic. After a few months, the requests died down, but we were left asking ourselves the question, how has the pandemic affected how humanitarian organizations use mobile technology, and what has the role of mobile network operators been in this? To answer this question, we decided to write a report focusing on M4H's portfolio. That means projects we fund through our innovation fund and projects that we support through strategic partnerships, both of which are funded by the FCDO. Based on this research, we came to three primary findings that I wanted to briefly touch on before I hand over to the excellent panel we have today. First, the humanitarian sector relies heavily on mobile technology, and as operations become increasingly digitized, it's unlikely to go back. Second, partnerships are key, including those that extend beyond the traditional humanitarian sector. And third, the humanitarian has exacerbated the risk of exclusion and the digital divide, and it's vital to consider the needs of marginalized communities. I'll go through each of these very briefly. So first, we found, like others, the humanitarian sector throughout the pandemic was dependent on mobile networks, and it was only through ongoing connectivity that operations were able to continue. This included both keeping in touch with staff remotely around the world and with end users. In some cases, this created challenges. Network resilience and last mile connectivity was tested, and in some cases needed to be improved. And in many cases, humanitarian staff needed to be trained in new skills. Digital skills are starting to be recognized as a core competency for humanitarians. But this dependency also led to opportunities. For example, one of the use cases highlighted in the report is information as aid, a use case that was particularly useful or particularly important during the pandemic. In any pandemic, timely, actionable, trustworthy information is key. And humanitarians in COVID-19 working alongside governments and mobile network operators used mobile channels to distribute life-saving information. They relearned the lesson from previous public health crises around the importance of tailored, locally relevant information delivered through accessible channels. Through our innovation fund, we worked with Mercy Corps in Haiti, and Justin will speak more to this on the panel discussion. Our second finding was that partnerships are key, including those that extend beyond the traditional humanitarian sector. A second use case highlighted in the report is mobile money, and this illustrates this point. In Africa, over 80% of relief efforts since the start of the pandemic were in the form of cash assistance. Increasingly, mobile money has been a popular delivery mechanism because it can be fast, transparent, and has the potential for multiplier effects beyond the transfer itself. However, this use case highlighted the importance of partnerships. Humanitarians worked with governments as the line between humanitarian relief and social safety net programming was blurred. And those that were able to respond the quickest and the most effectively, avoiding barriers like KYC requirements, were those who already had partnerships in place, particularly with mobile money providers. Mahamud from Telesom, one of our strategic partners, will speak further to this on the panel. Third and finally, the pandemic has exacerbated the risk of exclusion and the digital divide, as Barnaby already mentioned. Digital programming is not perfect, and it cannot be used in all contexts, especially to reach marginalized communities. However, as COVID-19 has highlighted, sometimes it's our only option available. And as we're moving towards an increasingly digitized world, whether we like it or not, we must work to make sure that we're doing so in the safest, most inclusive way possible. Based on what we've seen in COVID-19 across these findings, it's important to think about the future and how humanitarian organizations can work across both sectors and borders to create a more equal post-COVID world. And with that, I'll hand back to Barnaby to kick us off with the panel. Thank you.
Great, Zoe, and that's really helpful in setting up I think some of the themes that we're going to be able to dig into in a bit more detail, and I already see some questions popping up. So I think lots of things to discuss. So I want to turn now to our panel, which spans the globe and spans different parts of the sort of the humanitarian system. So hopefully we'll get to see some really interesting different angles. So I want to turn first to Mahamud in Hargeisa and ask you, as a mobile phone operator in Somaliland, how have you worked as a company with humanitarian agencies to deploy technology effectively during the pandemic? What challenges have you faced in terms of the digital divide, and how have you overcome them?
Thank you very much, Barnaby, and thanks for having us on the panel. In the context in Somaliland is actually quite different. Somaliland is a small and new country in the world. Well, new country. It's not recognized yet as a country. But what we have is, I was talking the other day. I was discussing in about 28 or 27 years ago, we had absolutely no infrastructure when it comes to telecom, and one has to travel to neighboring countries to make an international call. And this is how technology was in about 28 or 27 years ago. And today, people in Somaliland, they enjoy one of the cheapest data and voice services around the world. And through connectivity, we've seen doctors as far as Copenhagen helping remotely local doctors to perform certain surgeries and so on. And also, when you are somewhere else, you really take it for granted, all the technologies that you have. But within Somaliland, as we improve the connectivity and as we improve the coverage, more and more universities are open, and you see the education sector moving upwards, and you also see business side of things and the sort of ecosystem that you are creating within the telecom sector. In Hargeisa today, we have cloud services such as software as a service, infrastructure as a service, platform as a service, and so on, among other value-added services that we have. As connectivity improves, we see a huge growth in the IC sector. A number of applications that have been developed locally is growing, and we see a new trend of incubators or incubation centers that are creating more opportunities within the country. During the Covid-19, although we came from a long way from 28 years ago, the pandemic really highlighted the division that exists among those who can and who cannot afford the service or cannot afford the remote learning or distance learning for their children during the lockdown for their schools. And this is not just the connectivity and availability of power, but also the tools such as computers, laptops, tablets, and so on. And during the COVID, we provided phone line services for free for informal education sectors. And we also provided an online platform that allow schools and universities to use, but this was not including everybody, because a bulk of the majority of the people were not able to access. And the government of Somaliland also tried to provide remote learning through television and radios, and this was kind of a one-way channel, and it lacked interactivity between the students and the teachers. And this is where we really see, the public and private to partner together to create or to encourage, to improve the connectivity and availability of the access tools for the internet, so everybody can afford it and can access the system. We have also created, besides having stable communication services in the country, we realized there has to be a financial system that supports the development and economic growth of the country. And with the lack of a formal banking system in the country, we had to think about a way of overcoming the challenges of providing the traditional services. And we saw technology to be the means to leapfrog these challenges and provide a financial services that's for everyone. At the time of the launch, we recognized if we impose fees, it will undermine the mobile wallet adoption rate due to poor financial literacy of the community. And although we have achieved a higher penetration rate, we remain committed in maintaining no transaction fee strategy, but it's not to say that we are not really creating a revenue from the service itself, because the service has to be sustained. And we create a one-stop shop for the digital lifestyle of the people here in Somaliland. How did we work, or how did we try improving the humanitarian to respond disaster situations? Somaliland has gone through many natural calamities such as droughts, cyclones over the years, and mobile money platform became the lifeline that helped to connect between the urban and rural areas to support one another. And for example, you have the rural community moving from one particular region of the country and then going to another remote region. And what happens is as soon as the family reaches there, they will call up somebody in the cities, and they will say, look, I've just landed to this new area, and there is a company that is selling water or food and so on, and they will ask somebody within the country just to send the money. So instantly that person sends mobile money to their wallet account, and that's what really benefited those particular community who were in a desperate situation. With regards to humanitarian organizations, we have an existing partnership with a number of agencies, and we have a good understanding of the challenges that they face in delivering aid to most needed. So we came up with the next generation services, which we wanted to strengthen our existing relationship by providing not just efficient cash delivery, but also a cost-effective one. And we also worked with the ministries, and we provided, besides providing a protective equipment to win the fight against the COVID, we were one of the first operators to use the ringback tone to provide an awareness message. And actually this was became a ripple effect around the world. So everybody, the neighboring countries and everybody else has been, they start using the ringback tone. So usually operators do charge the ringback tone. So the user selects whatever ringback tone that they wanted to hear when they dial somebody or somebody dials them. But instead of really generating revenue from it, we broadcast the message that the Ministry of the Health was trying to get through to the to the population. And finally, what we came up was with the support of the GSMA, and we've done a pilot project with Care International where we provided a new solution This solution provides seamless access to their funds to those who are in desperate situation in a more dignified way, while addressing two major challenges in the humanitarian space, which is identification and also cost reduction. The humanitarian agents, there is a fatigue among the donors where people sometimes do not want to pay more money to the humanitarian agencies. So we wanted to come up with a solution where they use their funding in more cost-effective way and more efficient. And this was to come up with a solution that does a remote verification. So we came up with a voice verification, voice ID verification platform that allowed users to access the funding remotely without actually being mobilized in one particular area. And one of the things that the recipients praised upon was they said, look, I didn't have to queue. It was really more dignified way. I was at home, looking after my my animals, and the money came straight through my account, so they didn't have to go and queue it and being identified as someone who's receiving funding or support. I'll leave you to Barnaby. I hope I answered the questions that you asked.
That's perfect. No, thanks, Mahamud. That's, a really interesting example of how the technology has been used, before the pandemic, but how that's changed, and particularly the use of mobile money, and really interesting to dig into that a little bit more in the Q&A. So thank you, Mahamud. Really interesting to kick us off. I want to go now to Adelina in Jakarta and ask you, very different sort of context in Southeast Asia, but what lessons have you learned at the AHA Center on how best to use digital technology to respond to crises in your region, and how has COVID-19 affected this?
Thank you very much, Barnaby. Thank you, HPG, ODI, and GSMA for having me. Greetings from Jakarta, Indonesia. It's evening time here. To answer your question, COVID-19 definitely changed the way we do things. It was not easy for us in the beginning because we had to change our approach and we had to change our mindset. Prior to COVID-19, when there's a large-scale catastrophic disaster happening in one of the ASEAN countries, then we would fly out to the affected ASEAN country. We would meet with the National Disaster Management Organization of the affected country and the relevant stakeholders. We would send our regional assessment team, we would send our in-country team, and we would set up our on-site coordination structure on the ground. Even in Jakarta at our Emergency Operations Center, we would have our partners in our EOC from the UN, the Red Cross, the civil society, the ASEAN missions in Jakarta, the military sector, working together, working closely with our disaster monitoring unit to issue flash update and situation update. But this had to change, right? And yes, COVID-19 highlighted the important role and the positive role of technology. However, based on our experience, technology is an enabler. There are three key ingredients, and these are, according to our experience, are trust, value, and networks. So when we talk about digital humanitarianism, there are two aspects here: digital and humanitarianism, and also the relationship between digital and humanitarianism. So let's talk about digital first, digital technology. The way I see it, what is the purpose of digital technology? For us is to cut layers in information technology, layers in terms of resource mobilization, layers in terms of service delivery. So in information management, technology has enabled us, including AHA Center, to provide remote support for assessment so that we don't need to send assessment teams on the ground. In terms of resource mobilization, we have learned from Mahamud that technology allowed us to send money, the mobile money, directly to the beneficiaries. And in terms of service delivery, technology allowed us to provide trainings remotely. And that all because of technology. So digital humanitarianism should allow this, should allow the humanitarian system to cut layers so we can reach out to the beneficiaries more effectively and more rapidly. Then we go back to your question. The early prediction of HPG, the question why COVID-19 has not radically changed the way technology is used in humanitarian sector. Why? Why has not the system changed radically? Radical change is called disruption, making the status quo irrelevant. Innovation is less radical. It challenges the status quo. So then why is it there is a slower change in humanitarian sector even with the COVID-19? Because disruption, changing the status quo, is rarely an internal driven process. It's always the outside force. Think Uber versus taxi company. Think Airbnb versus hotel industry. Think Gojek in our case, Indonesia, versus Bluebird company, Bluebird taxi. So why internal force cannot make the radical change as you predicted? Because not everybody within the system may be comfortable about changing the status quo. We tend to think in a group thinking approach. We follow the pack. And the contrarian approach is not well rewarded and considered even controversial. So if we want the current system to radically change, Barnaby, I think it won't happen if we only rely on the internal system. Because what? We can still survive somehow. And there are no benefits. There are no gains in terms of changing the status quo. So the humanitarian industry or the system is also too big. On the other hand, radical change will only come from the outside. And that's what we call unicorn. That's what we call startup. Then let's talk about humanitarianism. I mentioned earlier, is technology is an enabler. Based on our experience in Southeast Asia, there are three key ingredients: trust, value, and networks, as I said earlier. Why trust is important? Because if there is no trust, then you cannot have the access. Why value is important? Value means we bring something to the table. We bring meaningful contribution to the affected community. Always ask the question, what is our meaningful contribution for them, not for us? It's never about us. Why network is important? And that is partnership, as Zoe mentioned, because we cannot simply work alone to understand every context and every corner of the world. So if we have strong value proposition, we have technology, but no trust, no network, no partnership, then we will leave ourselves alone with our resources. I will leave it at that, and let's have discussion further. Over to you, Barnaby.
Thanks so much, Adelina. Really interesting reflections on some of the ingredients of what works and what doesn't work, and what we need to think about kind of a little bit more, strategically, big picture. So thank you so much for that. I want to turn now to Justin in Haiti and ask you about your experience there with Mercy Corps. Maybe if you could pick up on some of the themes that Mahamud and Adelina have raised. What's different in Haiti? What have been some of your key takeaways in responding during the pandemic there?
Thanks, Barnaby. So Mercy Corps has been in Haiti since 2010. And to pick up on Adelina's points about radical change versus innovation, we had been working over the past few years, especially with GSMA, to think about how do we do more inclusive communications around preparedness for hurricane season. This led us to contact a social enterprise, Viamo, which has a mission to connect individuals and organizations to make better decisions via mobile. So these partnerships, these innovations were things that we're already testing even before COVID-19. So the first cases in Haiti were announced March of last year. And we already had this extensive partnership with this social enterprise that can harness the digital infrastructure that exists in Haiti. And so when COVID hit, we had to rethink, how can we pivot our existing programs to continue to deliver impact to the communities that we serve, and to deliver that in a different way while still maintaining those inclusive aspects. Mercy Corps, we were using interactive voice response, a technology for interactive robocalls, calls with through the mobile system. We're also using mobile money as a part of some of our social safety programs and our food security programs. So when COVID reached Haiti, the first step for us was to ensure that our team understood this new context, that understood what our communities were going through, and we're able to think about the necessary adaptations across the entire portfolio. I mean, this included how do we keep our team safe, how do we limit exposure in communities, which pointed us towards that existing partnership with Viamo. The second step was content design with the constituents. So we knew that, as a function of the infodemic, our program participants were getting all kinds of information through Twitter, through TikTok, through WhatsApp, through Facebook. And so we needed to meet them where they were at in terms of the types of information that they already had access to. So we did an information ecosystem assessment to understand, where does the trust lie? Who are the trusted voices? What are the trusted platforms? How do people access information? And then how do they turn around and share that information outwards to those that trust them? We put up a hotline, a free hotline, with interactive content that was designed specifically with 5 different personas in mind. So we created these personas using a human-centered design process, working with community partners. And these 5 personas responded to different beliefs and different needs along the spectrum of information access and socioeconomic status. So we made sure that our different community members could see themselves in one of these 5 personas. Then once we had these personas set up and the hotline was live, we leveraged the partnership with Digicel, who's one of the biggest telecoms in Haiti, to target users in an anonymous and aggregated way. We were able to reach users based on which antennas they were connected to, how much savings they had in their mobile wallets. Without actually revealing the identities of those participants, we were actually able to specifically target people along different segments of the socioeconomic status and access to information. The last thing that I wanted to say before I go into my takeaways was that we also made sure that we were looping back our information with the Ministry of Health. We wanted to not duplicate what they were saying, but present a parallel story to what they're saying to build that overall trust in the information that was being provided, all the while using the information that was shared back with us through these interactive calls to feed back to the Ministry of Health and help inform how they were adapting their messages over the context of the pandemic, over the life of the pandemic. So in terms of takeaways from this program, and our response to COVID-19, I mean, it was hugely successful. We were able to reach 2.2 million Haitians, which is over 20% of the population, with key messages around COVID-19. And we realized that COVID-19 provided the impetus to enhance our traditional behavior change approaches by adding on that layer of mobile tech, by adding on that layer of interactivity when we weren't able to do those face-to-face meetings. We also realized that it's existentially important to spend sufficient time thinking through the human factors. What is the access to information? What are the levels of trust? How does my socioeconomic status influence my information sources and influence my level of being able to take risks, but also my level of being able to adopt protective behaviors against COVID-19. The third and nearly last point that we took away was that mobile also presents a unique opportunity for ease data analytics. Every interaction that we had with participants through the IVR platform allowed us to collect information about what their beliefs were, what their fears were. And so this, through kind of question and answer sessions using the IVR platform, asking people, you know, do you believe this rumor about COVID, yes or no? And then they would respond, and then we would say, good, you know, you're plugged into the right information sources, keep it up. Or to be able to correct disinformation was really important. The final point goes back to this trust element. So it was important when we started off to start off with kind of low risk, commonly accepted sort of messages, and to create a dialogue with our communities. Once we built that trust, we were slowly able to point to other trusted source of information. So we were able to, you know, link our system more with the Ministry of Health or with other systems that were available in Haiti at the time. And I think that trust point, I mean, that's been brought up a couple times over this call, and that's been really important as far as creating that dialogue and building off of that over the course of time. That's all for me. Thanks.
Great, thanks, Justin. And I mean, some really interesting themes kind of resonating with what Adelina and Mahamud were talking about. Lots of interesting resonance there about partnerships, needing those in place, but also how those evolve. These questions around trust and information, and the importance of sort of putting people at the center and the local context. So we've got time for some of the questions. The Q&A has been buzzing. So I'm going to try and pick out some of the themes and go back to the panelists with some of the questions. I mean, I really want to pick up, which has come through in some of the questions, and I think all of you talked about this question of trust and how that is a really important, I mean, you said it as one of your 3 factors, Adelina. So maybe I could come to you and ask you first about, how do you build trust when it can be a barrier for people to use new technologies, and particularly when you're trying to do this remotely? How do you do that? And I think one of the questions in the chat, which I think is really related, is then particularly when you've got around COVID, you've got disinformation, you've got rumor, and that can really undermine trust. What have been some of your experiences of how to build trust and how to retain trust when there's so many different swirling rumors that people are trying to navigate? I could go to you, Adelina.
Thank you very much. It's a very interesting question. So thank you for that. And definitely it's not easy, but let's re-examine the question here. Is trust really a barrier for the affected population to use the new technology? Is really the problem the trust of the people on the new technology? The barrier perhaps may not be the trust of the affected population towards the new technology. The barrier may be towards the people or the organization behind it. When you have a life crisis, who will you listen to? Someone that you know already, that you trust already, or someone new? It's very difficult to build trust during crisis. Building trust itself is a long-term game. And you all know that long-distance relationship is very difficult compared to face-to-face. How long have we known each other, Barnaby? 10 years, perhaps, since the establishment of AHA Center. So every time you contacted me, I'm just WhatsApp away, right? And I would respond right away because I know people from the ODI, from HPG for a long time. We have met in several occasions. So the process is very quick already because we have known for quite some time. We have talked a lot through many occasions. But if it is a new partner and building all that during COVID-19, when crisis happens and we don't know them, it's going to be very difficult. It will take a long process. So then what to do? If we can only do it remotely, will it stop us from building trust and building networks and creating values and partnership? So perhaps if we really have to do it remotely, then why don't develop it through the partners at the local level, local partners that are trusted by the affected population, by the local population. But we should also be careful, yeah? Consider them as partners, not your contractors. It has to be win-win situation. And at the end of the day, we also need to ask ourselves again, and this is my message also for the HPG ODI CDAC webinar, create resilience, not reliance. So when we want to build the trust, the objective is to create partnership. The trust will be broken if they knew that after that you will create really reliance. Then it's not actually the technology that you offer, it's you, it's us, right? So therefore trust is very important, value is important, networks is important, but I think our intention is also important. And the success indicator should also be clear. Is the success indicator to make people more reliant on us or resilient? Is the success indicator when we train people to make them better than us or for us to get engaged all the time? If we keep providing training for 20 years to the same community, there is something wrong. So it's not about the new technology. It's not about technology. It's about us. Thank you.
Thanks, Adelina. Yeah, really interesting that I think this sort of keeping the focus not just on the technology, but trust is a much bigger thing. I mean, I want to kind of ask you, Mahamud, a sort of, related question around trust. And I think this question of how you build partnerships, and you've talked already about sort of the partnership you built with Care International. One of the questions in the Q&A has been about, what about where, you know, you're in this quite sensitive position between humanitarian organizations, individuals, sometimes vulnerable, seeking assistance. How have you built those partnerships and built trust? You know, when people are, sometimes they don't trust, you know, the public sector, they don't necessarily trust the humanitarian organization. What's your experience from Telesom's point of view?
From operators' point of view, we had the mobile money for about 10 years, and over that long 10 years, we established that trust. This would have been a very different question if you would have asked me back in 2009, when everything was new and we had to teach people, and the sort of slogans that we were using at the time to tell them, with this platform, you're going to save and you're going to send money to your relatives and receive payments and so on. And, you know, people were very skeptic, and they were saying, how can I trust digital currency? So that was, you know, a bit of a challenge. But then, as soon as they see the use cases and they manage to use for everyday lives, go to the groceries and use your mobile money, go to a restaurant using your mobile money, and we created that sort of a value for them. Then, you know, the trust slowly builds up. The trust slowly build this up, and we really don't have any issues because I don't know if you are aware of it, but the active rate for the mobile money in Somaliland is about 78%. So most people are using the platform and are already familiar use case of digital currency, and there was never issues about people not trusting the system itself, But in terms of the partnerships, the cash for voucher, the CVA, it's been around for a number of years now as well, and humanitarian agencies have been able to use a bulk payment, mobile money bulk payment system where they will, send a bulk payment to so many dispersed communities instantly. So, but when we came up with the solution, which was actually, we almost launched about the right time with the COVID, with the voice verification platform. And, we went to the communities the NGO, the international NGO went to the community and they mobilized the community and they told the community that, they will be getting their payments through their voice. And we had to create that awareness and posters, and we had to inform the community beforehand, before actually, putting them onto the platform. So, you talk to them, you inform them, you let them know how to use the system itself. And then when they see the use cases and how seamless it is, then they were able to trust the system itself. And, from a humanitarian perspective, this gives transparency. So you can actually get the real-time data, and you can actually see in real-time terms of how many people collected their payments through the system. So, and which can then be shown to the donors for an audit purposes in real time. So the donors can actually see themselves as well, that their, the money that they contributed to whatever disaster that they were managing at the time, it's actually being seen, and they can actually see that data and they get that data instantly. So, these kind of a thing built the trust, and, working relationship with the humanitarian agents for a number of years, that also helped. And, it's always nice to build as early as possible before you actually introduce any sort of a new product or any sort of a service. And we were lucky because both the humanitarian and both Telesom, we were all working towards a common goal. So how do we improve and how do we reduce the cost of identifying the recipients and so on? And really, it went quite well, as and the success rate was amazing. Almost, it was about 97% success rate, which gave us quite a bit of an encouragement for both the humanitarian aspect side and also from the mobile operator side.
Fantastic. I mean, really, yeah, another interesting sort of detail from Somaliland. I wanted to sort of ask you a similar question, Justin, in terms of your experience there, but particularly maybe bringing in, as well as the sort of trust and partnership, and we've heard a bit about how that's been developed. A couple of questions around how do you ensure the sort of the voices of the affected community, and particularly looking at this question of the digital divide. Are there any particular kind of gender sensitive approaches that you've found successful in order to ensure equitable access?
Thanks for the question, Barnaby. So for making sure that the voices of the communities in which we work are included, I mean, it was absolutely essential to turn to our Haitian organization partners as a part of that information ecosystem assessment, as a part of that design of our platform, making sure that, that the types of messages are the messages that will speak well, that present, like Mahamud said, a use case, a compelling use case to the communities. I can give, two quick examples that also tie into the gender aspects. We did note that when schools closed down, that this created a lot of tension on families. This created a lot of issues with increasing stress in the household. So one of the things that we built into our platform was, welcome to the Labe platform. Are your kids driving you crazy? Press 3 and then give them the phone. And then we had these facilitators guide them through hand washing songs, sharing key messages around COVID-19 in a child-friendly way, but also talking about stress management. And it's okay to be nervous about what you're hearing on the radio. Talk to your mom or dad about it. Talk to your grandparents about it. Here are things that you can do as a child to stay safe. And we got a lot of positive feedback around from parents on that specific module. I mean, another one that we did was kind of a call and response joke methodology, which is very common in Haiti, and it's called click clack, and it's basically a knock knock joke, right? For those of you familiar with knock knock jokes, in which we would have female voices going back and forth and sharing information, validated information with one another, but in a low pressure sort of way, and I think that it's important that those ideas were given based on our consultation with our partners, and then also the voices that we put on our platform were recognizable voices, men's voices, women's voices, children's voices, so that the community members in which we were working, they could also see themselves in those voices. And I think that that's a part of making sure that the message passes, making sure that people connect, but then also around trust. Maybe people that don't know Mercy Corps, they really like these messages, and then they refer them on to someone else. And so you're developing trust between neighbors, when Mercy Corps did not start off with that trust ourselves, right? So I think that gets around to the gender sensitive components. I hope that responds to the question.
No, that's great, Justin. Really, really interesting. It sounds like a fascinating part of the project. There's a whole lot of questions in the question and answer that we're not going to be able to get to. Things around financial literacy, digital literacy, which maybe we can sort of pick up on in future discussions. Conscious of where we are in the hour, I just wanted to kind of come back to you all and ask, as a final reflection, thinking ahead, kind of looking to the future as we hopefully start to come out of this pandemic, what would you say are the priorities for how we should engage with technology in humanitarian action in the future? What have we learned from this year or more of having to adapt to COVID-19? Maybe I wanted to go to Mahamud first to ask you this, sort of looking ahead, what have we learned?
Hi, Barnaby. It's really, some of the humanitarian agencies, sometimes it is a bit difficult to change old habits or something that you get used to it, which has been a norm for a number of years. And, and it's good to try out new things and see how that is responded to what you're trying to achieve. And with technology, you can really leapfrog or some of the hurdles that you normally go through. So technology, it's without leaving the human side or the empathy side, it's a tool that you can use to achieve a desired goal, which is to help people and to ensure that they get the adequate safety net that they are looking for. So I would encourage the humanitarian agencies to work with the technology providers to come up with these solutions, but both from an operator side and from humanitarians, you really have to be open-minded and be both willing to work together to achieve that common goal.
Great, really important messages there. Thank you for that. Same question I wanted to ask you, Justin, in Haiti. This question of, what does the future you know, what can we learn from the past for the future in terms of how we engage with technology in humanitarian action?
Yeah, I think that we need to always identify first and foremost the human problems, right? What are the relationships that exist? What we talked about trust, we've talked about partnership and networking. I mean, the problems often stem from these outside crises that push us as people to seek solutions, and by starting with like the human-based solutions and then layering the technology on top, I think that that's when we see an effective combination that is allowed, that really makes a big impact, right? Because a lot of times we tend to, use technology and try to use it for everything, right? And it's the solution to everything, but it can enhance most of our programs, I would say, but we really need to focus on the human problem at the beginning, and try to bring those adapted technology solutions to that when they're appropriate.
Yeah, no, really, that's a really clear message. I think that's coming through from a lot of the examples in very different situations, very different contexts, this kind of human element. So Adelina, what are your final thoughts on this question, looking ahead? What have we learned?
What have we learned? If we only use technology and we don't consider the elements, the other elements, and these are what I have mentioned earlier, the trust, the value proposition, as well as the networks, then we will not be able to maximize the potentials of technology for humanitarianism, for our humanitarian work. And that is going to be really unfortunate. So that's one, right? So then, if there are super digital tools out there, right? And if these three elements or ingredients, it can be more than three, are not fully addressed, then when we bring digital tools to the affected communities, we will actually further deepen the humanitarian digital divide. And we will bring more inequalities in our communities. So I think we really have to be very careful when we bring new technologies without considering the humanitarian element. So when we talk about digital humanitarianism, always think not only about technology and technology's enabler, but the three key ingredients that I've mentioned. We should never have any wild imagination that we can go around the trust issue very easily by building superb technology, as I mentioned. It just doesn't work that way. We will never be able, because we talk about digital humanitarianism, it's not only about digitalization, digital humanitarianism, right? So the core ingredient of humanitarianism, that is trust, will have to be there. Our problem in the humanitarian world is not about technology. Technology is not the issue here. Our problem has been on the trust deficit among the key actors involved. So digital humanitarianism in the future will only create values if the element of trust is involved and is addressed as the main dish, not the side dish. Thank you.
Fantastic, thanks for that. And I can only offer you a very quick dessert after all of that. Really interesting reflections, really, I was going to say some food for thought, which seems very appropriate following on from that. We are now out of time, so I just wanted to say a really warm thanks to our wonderful panel for joining us today and sharing their thoughts from all different corners of the globe, to GSMA for this really fruitful, interesting collaboration. And thank you to everyone who's tuned in and taken part in the discussion. Lots of questions that we weren't able to get to. So we will share links to the reports that we've discussed today in the chat box, as well as some further links to things that you might be interested in. There will be a recording of this event on the event webpage where you registered in a few days' time. So please do share that with your networks and feel free to watch it again. And on that note, I want to wish you all a very good day and thank you all again. Goodbye for now.